All right, let's keep up with Ken. Have a follow-up video about my prostate cancer and what I decided to do for it. It was called the TULSA-PRO, which is ultrasound ablation of the prostate. I'm sure all the men that have been recently diagnosed and talking to their urologists understand you get a bunch of options and then you have to decide what to go with. I went with the TULSA-PRO. Anything I say is not medical advice, but I want to tell you what my experience was after the TULSA-PRO, my PSA trends, and how they are looking. I had my TULSA done in October of 2025. In January, I had MRI to see what the results were on a PSA test. The MRI came in high unlikelihood of any cancer. The PSA in January of 2026 came in at a 2.1. That was 3 months after the TULSA-PRO procedure. My next PSA after that was in April of 2026. About 6 months out from the TULSA-PRO, that came in at 1.0, so it went down from 2.1 to 1.0. And then I had one more PSA 3 months later. In fact, I just got it last week, beginning of August of 2026, and it is a 0.9. So it's went down 3 times in a row. I'm down to 0.9. That's been my trend. It's not like having your prostate removed, because I still have a prostate. I have about a quarter of my prostate left. I had all my cancer on the right-hand side. They ablated, burned out, torched, whatever you want to call it, about 3/4 of my prostate. So it's expected that I will still have PSA, but the trend is your friend. So if it keeps going down or goes down and stabilizes, I guess that's a good thing. As we all know, no guarantees when it comes to prostate cancer. It can come back at any time, or it could be gone for the rest of my life. So the aftermath after the TULSA-PRO was some leaking. I had to wear a catheter for 10 days. Afterwards, I got a UTI when I had my catheter removed. Had to have a catheter for 20 days after that. So a total of 30 days after the actual TULSA-PRO procedure, I was wearing a catheter 2 different times. That's not the norm. Maybe I'm just special getting those UTIs, which that wasn't good. A couple emergency trips to the ER, and another trip up to see my urologist to get my prostate drained when he reinserted the catheter. But I got through all that after I had catheter removed, trying to get back to normal. I had a little bit of leakage, and for example, if I would sneeze, I would pee. Sneezing and peeing, pretty common. And at least for me it was. Wore a little pad for a little while, but I got my incontinence back real fast. So that was one good thing about the TULSA-PRO. If you're looking into that, I am as dry as I was before the procedure. What else happened after the procedure? Because they ablated so much of my prostate, I now can, my sleeping is much better. I don't tend to urinate as often. Long drives in the car, I can hold it forever now. I don't have that urgency, so I guess that's a positive thing. My erections after the TULSA-PRO, anytime you mess with the prostate, men want to know about erections and about being incontinent. So you want to know if you're going to be, in diapers or castrated for the rest of your life, right? But erections, it was kind of damaged below, so they didn't really come back. And Right now we are 10 months out of the TULSA-PRO, and for several months, basically not too much going on down there, but I am getting nighttime erections again. Things are improving, so maybe because I had the UTIs, that set me back a little farther than the normal TULSA-PRO patient, but I am getting my erections seem to be improving. I have started getting nighttime erections like a normal man again. What happens with the TULSA-PRO, because they did burn out the whole right side of the prostate and then some for me. When they damage the nerves along the outer edges, that pretty much stunts your ability to get erections. Even with Viagra, Cialis, or something like that, because the nerves don't respond to that if they are stunned. So anyways, apparently something positive is happening, because I have started over the last several weeks, started getting nighttime erections again, so that's a good thing. So that's positive. So for you men worried about that, which obviously I am, I still happen to enjoy having a good adult life. That all seems to be coming back. So that's my experience. What else can I tell you about my TULSA-PRO? All in all, it's kind of a roll of the dice no matter what you do. I think I made a right decision for me, because my prostate cancer was intermediate grade, 4 Poilas, 3 Gleason score. It was on the right side, near a problem area they could see, but it wasn't in the problem area. It was invisible on the MRI, where they found the exact cancer when they did biopsy. So, hopefully they ablated all those cancer cells out, and the PSA is showing a positive trend. So anybody out there thinking about the procedure, mine was paid for by my Medicare Advantage plan. I had mine done in South Carolina. It just depends where you want to go. If you have just a regular Medicare, the Mayo Clinics do perform TULSA-PROs, and they are covered by regular Medicare, but they told me not my Medicare Advantage, so I had to look farther, but I finally found a place that I could do it. So that's it. If you have any questions about the TULSA-PRO, I've been through it. So that's it for now. Hopefully, life stays good, and, with any luck, maybe I put prostate cancer behind me for now. So here in sunny Georgia, keeping up with Ken is out.